Inspector Madame Guo Yanhong from NSH Medical Policy Administration Bureau, Jiang Jian, the Medical Administration of National Administration for TCM, Mr. Li Li, the same administration, DG for Science Technology Department, Biological Center of most. They're going to talk about the progress of the drug development as well as the support that we should give to the medical workers. And also they are going to share with us some medical tests. First of all, update statistics. By February 16, new confirmed case 2,048 from 31 provinces, Xinjiang. New death 105, 100 from Hubei, 2 from Henan, 2 from Guangdong. New suspected case 1,563. Killed number 1,425. Close contact of medical observation 28,179. Severe case reduction of 628. By the same day, based on the report from 31 provinces in Xinjiang, confirmed cases 57,934, of which 10,644 severe case. Accumulative cured number 10,844. Accumulative death cases 1,770. Confirmed cases 70,540. And suspected cases 7,264. Close contact traced 546,016. For the statistic in Hubei, confirmed cases 1,931, 1,690 from Wuhan, and killed weight 1,016, 543 from Wuhan, and new death rate case 176 from Wuhan. Confirmed case 49, 8,847, about 36,385 from Wuhan. Severe case number 9,797, about 8,056 from Wuhan. Discharge rate number 6,639 and 3,458 from Wuhan. Accumulative death number 1,696 and 1,309 from Wuhan. Confirmed cases 58,182 and 41,152 from Wuhan. Increased suspected case 909, about 338 from Wuhan. And also 87 confirmed cases reported from Hong Kong, Macau, and Taiwan. 57 from Hong Kong, 10 from Macau, and 20 from Taiwan. And also, we have new case 5, and also reduction of severe case 29. For 13 days, the confirmed cases has been dropping, and also the mortality rate has been maintained at a low level. So that's the update of the statistics. End of yesterday, we organized a meeting by NHC, the Joint Expert Committee from WHO, as well as the representative from the ministries of the Chinese government. Altogether 80 attended the meeting, and chairman of NHC introduced the measures adopted by China, indicating that positive measures have been taken and positive result has been achieved, and China will continue to work together with the international community to meet up the challenge and for the sanitary security of the international community. And we welcome all the positive suggestions. Most MARA and State Administration of Drugs and also National Administration of TCM all of them introduced their measures and work, as well as the representative from Hubei provincial government through video has introduced their measures. So the specialists and experts at provincial level also participate in the meeting. The experts have talked about the outbreak situation, the management of the wild animals, the progress of the drug development. They shared their opinions, and also they spoke highly of the positive progress made in this regard. And also they expressed their appreciation for the professionalism by Chinese medical workers. They're going to Beijing, Guangdong, and Sichuan for a few trips shortly. So let's open the floor for questions. Please identify yourself before posing questions. And the first question, this gentleman on first row. Thank you. From CCTV Broadcasting. We see more than 20,000 medical workers being sent to Hubei. Which department they represent? And they do need coordinations among these team members from different departments and places. How to achieve this objective? Madam Guo would like to answer the question. To do their best to save and treat the patients is a top priority for us, especially for Wuhan, Hubei province, where a lot of large number of patients, and especially severe patients, are concentrated. That's why we're allocating natural resources to support Hubei and Wuhan to do a good job of treatment, to increase the cure rate and to reduce the fatality rate and infection rate. In terms of the intensity of such measures, 29 provinces, autonomous regions, including the Xinjiang Construction Corps, they send out total 32,000 medical workers to support Hubei, Wuhan, primarily from the respiratory infection domains, and also a large number of nurses. Especially given the large number of severe cases in Hubei, we have a very strong team from that domain. About 11,000 experts from this area are in charge of taking with the severe case patients. And these 11,000 experts and doctors, they account for almost 10% of all the resources available in this area. And we will continue to give more support to Hubei, Wuhan, so as to do a good job and to maintain good health for our people and patients. And also, people going to that part of the country are the best experts. 3 teams led by academicians by Zhong Nanshan, Wang Chen, and Madame Li Lanjuan, respectively. All of them are working at the first front, especially in giving their recommendations for these complicated severe cases, and has been exploring these new therapies and techniques, and what have already incorporated these effective therapies as part of this treatment protocol. And the 6th version of this protocol is coming out, which will contribute to a higher rate of cure.
Therefore, mobilized 22 national rescue medical teams with advanced equipment to help Wuhan to enhance their capacity. We also have 3 P3 mobile labs and testing personnel to help Wuhan and Hubei province to increase their lab test capacity and results, and increase the speed of diagnosis. In addition to Wuhan, there are 16 prefectural level cities. We use province-to-city pairing-off mechanism to help those 16 cities other than Wuhan, so that we have specific assignments to have 2 increases and 2 reductions. Of the 16 cities, some have very severe situations like Huanggang and Xiaogan and Jingzhou. You have 2 provinces to pair off with each of them, so that we can mobilize the whole country to help Hubei province and Wuhan city and those 16 cities to accomplish the tasks. Okay, the floor is open for questions. The journalist at the 3rd row at the left. I'm from Today Daily, and for new coronavirus, many people say that it will totally depend on our immune system. So I have a question regarding new coronavirus and pneumonia. Do you have a specific diagnosis and treatment methods? After curing, will that be a possibility of relapse? I would like to ask Madam Guo Yanhong to answer the question. Thank you for your question. The answer is clear. This is an emergent infectious disease. However, it is preventable and curable. Just now, the Director General has mentioned, according to latest data, for cured and discharged cases have exceeded 10,000. And to our delight, we have seen that situations in other places other than Hubei province have seen new confirmed cases have realized successive decline for 13 days. That means the disease prevention and control efforts have been quite effective. According to our analysis of the situation, through the analysis of the cured and discharged cases, we can see we have come up with a set of effective diagnosis and treatment strategies and methods. Out of 90% of the discharged cases were mild cases, 10% were severe or critically ill cases. If you have a breakdown analysis from onset to diagnosis, average length is 4.95 days from onset of symptoms to diagnosis. That is to say, we have shortened the diagnosis time to have early diagnosis, and that is also a very effective way of increasing the cure rate. We have also analyzed those cases. More than 90% of the patients used antiviral treatment, symptomatic treatment, or increase of the immune response, circulation support and respiratory support, like ventilators, to increase the cure rate. And we are delighted to see that situation in Wuhan has also been greatly improved, especially recently, through early diagnosis and early treatment, through the admission of mild cases and continuous observation. You can see the proportion of severe cases has reduced from 38% of the very beginning to now to 18% now. So 4 early and 4 concentrated measures have enabled us to increase the admission rate and cure rate and reduce the mortality rate and infection rate. These effective strategies and methods will be summarized as a set of measures to increase the admission rate and cure rate and reduce the mortality rate and infection rate, not only for the use in China, but also for the international community as precious experience. Thank you. The floor is open for questions. The journalist at the 2nd row in dark. Thank you. I'm from China Media Group. Just now you have mentioned, now we are strengthening the pairing off support for cities in Hubei, for frontline healthcare workers. They have high possibility of infection and they are working under pressure. Any specific arrangements for the rotation of work by those healthcare workers? Please, Madam Yan Hong. First of all, we need to feel proud of the healthcare workers of China. They are using their own actions to show their professionalism of respect for life sacrifice and great love. They are the most admirable people in the new era. They are the heroes of China and the heroes of the world. Therefore, safeguarding the physical and psychological health of healthcare workers and help them to accomplish their work is an important piece of work for us. Not long ago, the National Health Commission, Ministry of Human Resources, and Ministry of Finance jointly released a document on caring for healthcare workers and improving conditions for them, which was forwarded by the State Council across the country. The document is a very good one, which requires that we should create conditions favorable for the work of the healthcare workers. We must have reasonable arrangements of the schedule of daily work of the healthcare workers, enhance the personal protection for them, and have targeted psychological interventions and counseling for them, and enhance care for them, and very good logistic services for healthcare workers should also be provided. Multi-pronged measures are being taken so that they can wholeheartedly work to treat the patients without any worries. The frontline healthcare workers are undertaking very huge tasks, very huge workload with very high infection rate under great psychological pressure. Therefore, we have made very detailed working measures for the arrangements of work of the healthcare professionals. For example, arrangements of shifts, rotation of different shifts. We hope that those healthcare workers not only help treat the patients, but also to the maximum extent protect their own health. Thank you. Floor is open for question. The third journalist on the left side at the second row. Thank you. I'm from Phoenix TV. I have a question related to drugs R&D. We noticed that the most spokesperson has mentioned there are 3 drugs under clinical trial: chloroquine, rampiravi, and remdesivir. Any drugs demonstrating clear efficacy, any effective drugs in TCM? Madam Sun Yanrong and Li Xi will be asked to answer the questions. Madam Sun first. Thank you for your question. In light of the rapid development of the outbreak, how to increase the cure rate has always been a daunting task and top priority for us. Drugs R&D has also followed the rules of old drugs for new use. For the drugs R&D team, they have mobilized the R&D resources of the whole country, first from tens of thousands to thousands to hundreds to dozens to several. So hydrochloride acid, chloroquine as an old drug is providing new hope for us. It is an anti-malaria drug that has been used clinically for more than 70 years. And it can not only fight against the malaria, but also fight against virus, wide virus spectrum. So, in light of this new virus, new disease, new outbreak, we should not only look at the in vitro effect, but also, more importantly, we must use clinical trials to evaluate the drug to see whether it can really be used effectively as a new drug. We mobilized the Beijing, Guangzhou, and Hunan provinces, including more than a dozen hospitals to evaluate this drug, and clinically we have clearly seen its efficacy,
especially improvement of the lungs, as well the rate of lung pneumonia turning negative. We can judge from these aspects that the drug use group is better performing reference group. We have patients who has been hospitalized and who receive this medical treatment. After using this drug, this nucleic acid turn negative, all these indicators turn positive, negative. Seeing great improvement. Among more than 100 drug users, we did not see any severe side effects. So based on this research, 15th of February, together with most and other ministries and institutions, we organized a video conference of experts headed by academician Zhong Nanshan, and also experts from the drug development and clinical trial experts. They try to see the effect of this drug on treating pneumonia, and they come to the conclusion that their opinion that this drug, which has been available for many years, and the safety is controllable based on these clinical trial results, it is clear that this drug is effective in treating new virus pneumonia. So based on the urgent need for this kind of drug, they are of the opinion that this drug should be incorporated into part of this treatment protocol and to be used more widely in clinical trial. So this drug, which has been available for more than 70 years, should be encouraged to be used more, to play more active role. And also, the task force that are responsible for developing drugs attach great importance to TCM. And we have done a lot of work headed by two academicians, are working very hard and with a lot of results. Now let's hear a bit more of these comments from Mr. Dichi Li Yu. So after the outbreak of the virus, under the joint coordination of the State Council leading group, our national administration has inaugurated the TCM drug development with the purpose, with two kind of projects, as Madame Sun introduced. This headed by academician Huang and Zhong, and also in Wuhan Jingtan Hospital and Ditan Hospital in Beijing, as well as another hospital in Wuhan, the development work has been done, and also in collaboration with Tianjin TCM University to start the clinical application of TCM for this pneumonia. So the work has been going on stably. And also, January 27th, we inaugurated the clinical screening of the TCM preparation for this pneumonia in 4 provinces in Sichuan, Shanxi. We tried to put in place certain TCM preparations to see its clinical trial effects and to do some analytical work. And also, the statistics, 424 clinical statistics cases that are positive, successful. And also, we came out with a joint circular to use this preparation in 10 provinces. 701 patients from 10 provinces have been using this preparation, and 131 has been cured, and 51 see the disappearing of the symptom, and more than 20 reduction of the symptoms, and the remainder see stabilization of the clinical medical conditions. And also based on the statistics of 351, before they take on this preparation, 112 patients, the body temperature more than 37.7 degrees. But after 1 day of taking this preparation, more than 51.6 of the patient see reduction of the body temperature to normal. And also 214 patients, they are suffering from different symptoms, but after 1 day of treatment, 47 of them see disappearance of the cough after taking the drug for 6 days. We see disappearance of this cough among the 80% patients. And also fatigue, pain of the throat, all these have been effectively addressed by this preparation. Among 351 patients, all these minor cases, none of these cases has been turned into severe cases. And among these severe cases, 3 of them have been cured, and 8 of them have converted into mild cases. 40 of them have been cured. So all these statistics indicate that this preparation is effective in the clinical treatment, and that makes us become more confident in combating this pneumonia with this medicine. And also, many localities have launched their drug development process and have come out with other effective preparations and tablets. Hospital number 8, Guangzhou, they have come out with a preparation which also is equally effective. Thank you. Thank you, moderator. I represent Hunan TV station. Some experts said this unstable quality of this reagent for nucleic acid, the positive rate is on 30 to 50%. So could we use other therapy like CT or blood test as a supplement to this reagent to improve the positive rate? First of all, the nucleic acid test, it's stable per se, but for cases where we see this false negative phenomenon, any therapy testing method has a sensibility issue. And also perhaps in that individual patient, this virus amount is very few, too few to be tested. This throat swab, if you take a sputum, then this test positive rate will go up. Nucleic acid testing is still a golden criteria, so we will continue to improve it. Recently, we have been working to further improve the sensibility of this reagent. And also, we have to, it's a comprehensive diagnosis, based on this reagent as well as the clinical symptom. In other words,
that's why we say clinical diagnosis. While there is no clinical symptoms, we can also initiate the management and treatment of the disease. That is to say, through clinical diagnosis, we can ensure the patients can be treated in a timely fashion and isolated to curb the spread and reduce the mortality rate. So clinically, we strengthen the integrated diagnosis capacity. And we're also conducting some research on antigen testing and antibody testing Ministry of Science and Technology, MOST, has been working on such technology program to develop antigen testing, antibody testing, or nucleic acid testing methods. I'm sure with the improvement of methods, we can increase the specificity and the sensitivity to make sure that the patients are diagnosed and treated in a timely fashion. Thank you. Left side, third row, the journalist, the gentleman there. Thank you. I'm from Xinhua News Agency. I have a question related to the plasma treatment. On February the 13th, China Plasma Group mentioned that 11 patients were treated and cured this way. I want to know the mode of action mechanism for such treatment. How many patients have received such treatment? What are the expectations for such treatment? I'd like to ask Madam Sun Yanrong and Madam Guo Yanhong to answer the questions. Severe cases remaining number is more than 10,000, and developers have also focused on the methods for treatment of the severe cases. We are in dire need of effective therapeutic solutions to reduce the mortality. Plasma treatment is an old and innovative treatment method. Over the past more than 10 years, in public health emergencies, such methods have been used. On February the 12th, the plasma treatment has been established as a possible method for initiation of a research project. I noticed that people are very interested and concerned with this treatment method. And China Biocenter is responsible for undertaking this project. We started deployments quickly in Wuhan. On February the 5th, we collected the plasma, and on February the 9th, in First Hospital of Jiangxia District of Wuhan, patients received the treatment of plasma replacement, and later, totally 11 patients received treatment. One already was discharged from hospital. One already can get off bed and walk, and the other remaining patients are also recovering. And the scientific and technology research group will also have evaluation of the expected efficacy and risks, and will make dynamic judgments and adjustments in a timely fashion. Up to now, we think it is a safe and efficacious method that can be used, but it is a systematic project that affects the whole society. Only when the government, the hospitals, enterprises, healthcare professionals, and the patients cooperate with each other can we rehabilitate workers, work with each other, can we increase the cure rate of the severe cases so that this method can be widely used clinically. And taking this opportunity, I would like to sincerely thank the first madam who have donated 350 milliliters of plasma, and I would like to thank all the patients who have donated such plasma. And I would also like to thank the healthcare professionals. It is them who brought hope for people on the verge of death. Now, more than 10,000 patients have been cured, but we still need to remember that there are still a remaining number of 10,000 severe cases, and those cured are hopes for them. I hope that we can have 1,000 people donating plasma, 4,000 people to be cured, so that everyone can lend a helping hand, so that love can be transmitted and life can be continued. So long as we can work together, I'm sure that we can win the battle against the virus and disease. And Madam Guo Yanhong, please. Just now, Yanrong has mentioned that for people already in the recovery period, their plasma can be a very effective way of treatment for severe cases. In the 5th version of the Diagnosis and Treatment Guide, we have already incorporated this method into the guide. And in the 6th version that is coming out, we also work on the details for the rehabilitate plasma, we use the antibody of these people to reduce the viral load of the severe patients. Through the treatment of the patients clinically, this method has shown its efficacy. For recovery period plasma, from collection to preparation and production to storage and clinical use, there is a very stringent set of quality control methods, and at different places we are establishing provincial expert groups on the collection of the plasma and the treatment of patients to ensure quality control throughout the process. We need to make sure that the blood donators are safe, and we also want to make sure that the patients, the severe cases, are also safe. Up to now, about 10,000 people have been discharged from hospital because they are cured. I hope that we can make full use of the plasma of those cured. This is a very good, favorable condition for us to cure the severe and critically ill cases. I would like to make a call to all those cured and discharged cases that you donate your blood plasma so that you can bring hope to those severe and critically ill cases. Thank you. Right side, the fourth row, the journalist along the aisle. Recently, National Health Commission released a notice on further improving the work of treating and curing severe and critically ill cases. What are the currently available effective methods of treatment, and what impact will the notice on such work? Where are you from? I'm from Health Daily. Thank you. I would like to. Into the guide. First of all, it is highlighted and emphasized that for severe and critically ill cases, we must have supporting treatment and symptomatic treatment. This is the most fundamental and critical treatment. You know, pneumonia is a disease involving low oxygen content in the blood. So through oxygen treatment and ventilators, after increase the oxygen content in the blood, it can ensure that vital signs are good and organ functions are operating well. And then discussions were made on when to use ventilators. Very detailed instructions in the guide so that oxygen therapy can be operated in a more detailed fashion at the grassroots level. And we have also explored early warning system. You know, early intervention is the most critical for reducing fatality. So in this version of the guide, early warning indicators are listed for reference by clinical physicians so that we can have early interventions.
So early interventions would reduce further the mortality rate. And also some new therapies have been added as part of the protocol. For instance, this plasma therapy for severe patients has proved to be effective. So in this new version of protocol, this therapy will be part of it. So hopefully, by amending this protocol, we would offer more guide to further bring down the mortality rate. Of course, with more experiences and coming out of the new therapies, we're going to see a protocol that will be amended in real time. Thank you. The gentleman. That lady. Thank you. CCTV. Talk about drug development and TCM. Let me follow on this issue. In many places, they have been using TCM to treat patients, including some TCM physicians have been traveling to Hubei, Wuhan. So would you say a few words about the use of TCM in the treatment process? Thank you. Thank you for your attention and interest in TCM. Since the outbreak of the virus, National Administration of TCM, as a member of this joint control mechanism, has lost no time in recommending 8 leading TCM experts into the national treatment team. And also, we have sent some of these TCM teams to Wuhan, for diagnosis, for summarizing the best practices, and also offer guidance for the local treatment of these patients. And also, we try to summarize the clinical experiences based on the experiences from different parts of the country in the treatment, and we done optimizations and to come out with TCM diagnosis treatment protocol to be part of this treatment and diagnosis protocol. So our experts, TCM doctors, are fighting and working very hard in the very first front. And local TCM doctors are actively participating and organize the best TCM experts to support Wuhan and Hubei. Among altogether, more than 3,100 TCM doctors from 28 provinces have been sent to that part of the country. And also, our department has sent out a team headed by 3 academicians, as well as 4 teams, altogether 588 experts to Hubei. They're working in Wuhan Jingyingtan Hospital, Xiajiang Shelter Hospital, and also Leishanshan Hospital. And also, TCM institutions have been involved actively. So we have the involvement of 26 provinces, and these provinces have set up the separately TCM team. And also, they have summarized some very good, effective TCM therapies in that process. And before that, the Joint Prevention Control Mechanism of State Council have come out with a guideline circular asking localities to set up coordination mechanism between Western medicine and TCM medicine, and also to encourage TCM to be involved in the whole process of treatment. By yesterday, the confirmed cases TCM have been involved in more than 60,000 confirmed cases. The participation rate is over 85-20%. So the application TCM in Hubei has been explained already. Outside Hubei, also TCM have been used to improve the situation of more than 80 patients. So as next step, we will further deepen the coordination mechanism between Western and TCM to actively explore the effective therapy based on these combinations so as to maximize the cure rate and minimize the fatality rate. Thank you. From China Education TV station, some medical workers argue that this new virus, pneumonia, can self-cure disease. Is it true that we would get cured just resting at home for a few days? Thank you. Well, it's an expression indicating that without special intervention or treatment, this patient would cure on his own. But self-cure does not mean that there need no intervention or treatment. It is true that some of the virus, thanks to its own immune system, are eradicated. So that's a general expression for this kind of phenomenon. For the infection of this COVID-19, it is true that some minor cases, just using some TCM get cured on their own. But let me emphasize one more time, the self-cure disease does not mean that we don't need any intervention or treatment. All the patients should be observed in hospitals like Shire Hospital, on one hand to block the further spread and transmission of the virus, and also to make sure that this patient do not deteriorate, because it is true that some of these patients all of a sudden deteriorate to the point of death. So, for those infected by this new corona pneumonia, they should go to the hospital for no delay. And also, I hope that the media should not overinterpret this self-cure or without any intervention or treatment, because for this no virus, all of them should go to hospital for treatment. Last two questions, please. Thank you. From Medical Forum. As you said, oxygen therapy is effective. In the fifth version, ventilation, oxygen support, all these are being further classified to have different categorization of this breathing support therapy. Would you elaborate on the significance of this different category of therapy for the patients? Thank you. First of all, this pneumonia is attacking our lungs, which is a very important organ for oxygen exchange. If it is problematic, then this process is affected, leading to the deficient oxygen, which will further impact these important organs like brain or liver, leading to the death in severe cases. So oxygen therapy is a very important therapy, no matter for minor or severe cases.
Early treatment can reduce the risks and prevent people from getting to severe stage. So there are different levels of shortage of oxygen, and in light of this, there are different types of support. One is just inhalation of oxygen, and some have to use the facial masks, and some have to use the ventilators. So depending on the severity of the disease and the shortage of extent of shortage of oxygen, there are different methods. Some are very mild cases. That means they do not need oxygen therapy because the lung damage is not that serious. That's why they don't have to use oxygen therapy and then can get cured. And for severe cases, they must use standardized therapy because only in this way can we block the further progression of the disease. Just now we mentioned the diagnosis and treatment guide for severe and critically ill patients. And we have also more detailed instructions for clinical physicians to have standardized oxygen therapy, to have more rational treatment efforts to further reduce the mortality. Thank you. Last question. Left side, fifth row, the third journalist. Thank you, Mr. Moderator. I'm from the 21st Century Herald. Just now mentioned mobile cabin hospital. According to my knowledge now, some patients were already discharged. I want to know the discharge criteria, and after they are discharged, how about the community level prevention and control? What are the things that should be done? I would like to ask Mr. Wang Guichang to answer the question. Okay. Talking about mobile cabin hospitals, it can admit mild cases. In this way, it can isolate the infection sources, and on the other hand, you can also treat these patients, because we mentioned just now mild cases may not need very strong interventions, just a symptomatic treatment like use of traditional Chinese medicine, reducing excessive heat of the body, excessive humidity of the body, or so to alleviate the symptoms. And for discharge criteria, since all the cases were confirmed cases, so the discharge criteria of these mild cases of mobile cabin hospitals are the same as the discharge criteria in version 5 of the guide. That is twice negative for nucleic acid testing. After they are discharged, they need to have home quarantine for 2 weeks, at least 2 weeks, for home quarantine to have systematic observation. And community level workers will give them guide on home quarantine. After 2 or 4 weeks, they should get back to hospital for retesting. And if they have another disease, then they should get treated. Most of the mild cases are in very good conditions. Only some exceptional cases became severe. So we hope that the severe cases can be treated and cured in a timely fashion. Thank you. That's all for the questions part. Now I would like to ask Mr. Wang Guichang to share with you some health-related knowledge. Some netizens mentioned 2 questions. One is the question already mentioned, that is convalescent plasma therapy. The netizen mentioned that collecting convalescent plasma to treat severe cases. If I'm just cured and I'm still very weak, if my plasma is collected, will it affect my health? I want to say that so long as the patient has recovered and reached the discharge criteria and is in home quarantine, then plasma can be collected, because we only take the plasma and the platelet and serum will be put back into your body. So usually it is whole blood collection, but this is only plasma collection, like 200 or 300 milliliter. Usually after 1 or 2 weeks, the plasma content will be completely back to the original level. So the damage to convalescent's body is very limited. So please do not worry. Some just now, the call has been made that convalescent plasma can help treat severe and critically ill cases. So I hope that the convalescents can very actively donate your plasma to contribute your bit to the cure of the severe and critically ill cases. And second, a collection of plasma and its difference from the normal blood donation. First of all, the targets are different. For new coronavirus pneumonia patients, only the convalescents can be the blood donator, because only these people have the antibody to neutralize the virus of the severe and critically ill cases. And second difference is only plasma is taken, not the whole blood. For normal blood donation, it is whole blood, including red blood cells and blood platelets. And after separation, in clinical use, sometimes we use red blood cells, sometimes we use platelets, sometimes we use plasma. But this time, we only need plasma, and other parts of the blood will be transfused back to the convalescents. And we also have routine testing, like hepatitis B and hepatitis C testing to prevent cross-contamination or infection. And for premises with conditions, there should be a comprehensive antibody testing. That is the antibody level of novel coronavirus. The higher the antibody level, the more effective. And also nucleic acid testing, it must be negative. That is to say, the discharged patients have been tested twice negative for nucleic acid testing, but before they donate the plasma, they need to be tested again. And for other parts, no difference from the normal blood donation. Thank you, Mr. Wang Guiqiang, for your information sharing. Just now, Dr. Wang has shared with us the knowledge on plasma collection. We can see that more and more novel coronavirus patients are cured and discharged, and they are also taken their own initiative to donate their plasma. Some have not fully recovered, but they already made an appointment and signed up for plasma donation. And more patients are signing up for such donation to pass on love. Virus is brutal, but people have love. They transmit love to save other people's lives. And I would like to thank those convalescents for their donation. Will bring more hope of life for the patients. Through the information sharing of this press briefing, you can see the professionalism of healthcare professionals and the hard work of the R&D people. They are all racing against the time. And in fighting the virus and bringing hope to people, it is thanks to their hard work that the patients are supported and the patients are having more and more confidence. Now, more than 10,000 patients have been cured and discharged. We hope that more can be cured and discharged. Tomorrow, at the same time, we'll have another press briefing, press conference. And if you have any questions, just feel free to contact us. Thank you for your attention. And that's all for today's press conference.